Hi Abby and Paige, I'm your student massage therapist today. What brings you in?
So I've been having some pain in my right hip and my right glute area, and then along with that I've also been having some numbing and tingling down the back of my right leg, like the thigh area.
Okay, and what would you say it is when it's at its worst out of 10?
Well, usually it's most aggravated when I'm running, and I'd probably put it at around 8, and then when I rest, because that makes it feel better, I'd probably have it at 4.
Okay, so we're going to be doing some general palpation now, just to see if you have any pain or tenderness in any area, so just let me know. And on the affected side, so I'm just going to start at the ankle. How's this feel? Any pain or discomfort?
Nope, that's fine.
And then how's this feel?
That's fine.
No pain or discomfort?
No.
And how's this feel?
That's good there too.
Okay, how's that feel?
All good.
How's this feel?
That's good.
No pain or discomfort?
Nope.
Okay, how's this feel?
Starting to get a little tender, but it's doable.
What would you say it is out of 10?
Probably like a 4.
Okay, and then I'll make my way up.
Yeah, that's getting painful up in there.
Okay, what would you say it is up here?
That's getting closer to an 8.
Okay, right through there?
Yeah.
Okay, and then how's it feel over here?
Yep, that's about the same. That's getting up there.
Okay.
That's about an 8 as well.
Now we're going to be doing a postural analysis. I'm just going to be looking if there's any misalignments. It does look like your foot is externally rotated, your right foot, and it looks like it's coming from the hip. Is this where the pain is?
Yeah. Especially towards the back.
Yeah, and this foot is externally rotated. So now I'm going to be checking your gait, which is the way you walk. We're going to be doing some range of motion now. I'm going to begin with active, and we're going to go through all the ranges just to see if you have any limited range of motion. Now we're going to be doing flexion with a bent knee. That's a non-affected leg. How does that feel?
That feels fine.
Okay, and that's within normal limits. Okay, affected leg.
This one starts to hurt right there.
Okay, and that's not within normal limits. Flexion straight leg. Non-affected, how does that feel?
That feels fine.
And how's it going back down for extension?
Good.
Okay, and then the affected leg.
It hurts right about there.
Okay, where does it hurt?
Right in here.
Okay, and then how's it feel going back down?
Going back down feels fine.
Okay, and that wasn't within normal limits. Now we're going to be doing abduction of the non-affected leg. How's that feel?
That feels fine.
Okay, and then back in for adduction. How's that feel?
That feels good.
And then for hyperadduction. How's that feel?
That feels fine.
Okay, and that's all within normal limits, so that's good. That's your affected leg. Abduction.
It hurts right about there.
Okay, and then coming back in for adduction. How's that feel?
That feels fine.
Okay, and then for hyperadduction, that's within normal limits. Extension, we're going to do the non-affected leg first, and I'm just going to hold your hips down so that you don't swing or anything.
Okay.
So whenever you're ready, how's that feel?
Good.
Okay, no pain or discomfort?
No.
That's within normal limits. And then the affected leg, how's that feel?
Good.
Perfect, that's within normal limits. Internal and external rotations, you're going to have your leg up like this. This is external rotation, and this is internal rotation. Non-affected leg for external. How's that feel?
That feels fine.
Okay, that's within normal limits. And then internal, how's that feel?
That feels fine.
That's within normal limit. The affected leg, okay. External.
That's painful there.
Okay, where's that painful?
Right in here.
Okay. And then your limit is a bit limited, and then we're going to be doing internal. How's that feel?
That feels fine.
Okay, that's within normal limits. So now we're going to be doing passive range of motion. I'm going to be taking you through all the ranges, and that is just to see if you're limited of any of the non-contractile tissue ranges. Non-affected side with a straight leg for flexion, how's that feel?
That feels fine.
Then extension back down, how's that feel?
That's fine.
So the normal limits, and those were normal end feels, they were ligamentous. And the affected leg, straight leg flexion. How's that feel?
That feels fine.
Okay, and that's a normal end feel with the normal limits. How's it feel going back down? Good. For extension. Perfect. Flex leg flexion. How's that feel?
That feels fine.
Okay, and that's a normal end feel. And then how's it feel going back down?
Good.
Okay. Flex to knee flexion. How's that feel?
That feels okay.
That's a normal end feel. And then how's it feel going back down for extension?
Good.
Perfect. Now I'm going to be doing abduction of the non-affected leg. How's that feel?
That feels fine.
That's a ligamentous end feel. And how's it feel going back in?
Good.
Okay, and then hyperadduction. How's that feel?
That feels fine.
Perfect. Doing abduction. How's that feel?
That feels fine.
Okay, and that's a normal end feel, which is good. That's just the normal limits. How's it feel going back to adduction?
Good.
Now we're going to be doing hyperadduction. How's that feel?
I feel a stretch in there.
Where do you feel that stretch?
Right in here.
Okay. Yeah, we're going to be doing internal and external rotation of the non-affected leg. So this is external. How does that feel?
That feels fine.
Just going to hold internal. Does that feel?
That feels fine.
That's normal end feels for both and with the normal limits. And then this is external rotation. How's that feel?
That feels fine.
Okay, and that's with the normal limits and normal end feel. And then for internal rotation.
That's a little painful.
Okay, where's that painful?
Right in here.
Okay. And I'm going to be doing hyperextension. So, how's that feel?
That feels fine.
Perfect. That's with the normal limits and normal end feel. The affected leg, we're just going to start with hyperextension. How's that feel?
That feels fine.
Okay. Metric resisted testing. So that's testing the ability of the muscle to sustain the contraction for 2 seconds. So I'm just going to be doing the affected ranges for active. I'm just going to be doing it on the affected leg just because of timing today. So I'm going to begin with external rotation. So that is this range. You're going to want to go into external rotation. And I'm going to be resisting you for 2 seconds. I'm going to take you halfway through the range. Whenever you're ready. 1, 2, okay. Was there any pain or discomfort?
Yeah.
Okay. And I would probably rate that like a 3 out of 5.
Okay.
Now we're going to be doing abduction, so that's just bringing your leg out. This is the affected leg. So I'm going to take you about halfway through the range, and whenever you're ready, you're going to try and abduct your leg, and I'm going to resist you. 1, 2, any pain or discomfort?
Yeah.
Okay, and I'd probably say that's about 3 to 5 again. Now we're going to be doing flexion, so I'm just going to have you try and flex your leg, and I'm going to be resisting you. 1, 2, perfect. So that was probably a 3 out of 5. Was there any pain or discomfort?
A little bit, yeah.
Okay. Now we're going to be doing dermatome testing. That is testing the nerve root that innervates the section of the skin. Seeing you could be hypoesthesia or hyper. So hyper is having too much and hypo is having not enough. It should be normal, which is a 1. So I'm going to be testing L1 first on the front. So this is the affected leg. How's that feel?
That feels fine.
Okay. No abnormal sensation?
No.
And this is the affected side. How's that feel?
That feels fine.
Okay. I'm going to be testing L2. Non-affected side. How's that feel?
That feels fine.
Okay. Now for the affected leg. How's that feel?
That feels fine.
No abnormal sensation?
No.
Perfect. And I'll get you flipped over to do the other side. So I'm going to be doing L1 of the non-affected leg. How's that feel?
It feels fine.
And the affected? How's that feel?
Feels fine.
Okay, L2. How's that feel?
It feels fine.
Okay, and the affected side, L2, how's that feel?
Good.
Any abnormal sensation?
No.
Okay, now I'm going to be doing S1. Maybe a little ticklish. How's that feel?
It feels fine.
No abnormal sensation?
Nope.
Okay. And then on the affected side, I'm just going to be doing this over the table. S1, how's that feel?
That feels fine.
Okay. No abnormal sensation?
Nope.
I'm going to be doing reflex testing, so I'm going to be doing L5 first. That is hamstrings. So you just want to relax. I'm going to find the tendon. If you just want to try and push up, perfect. Relax. Okay, and that is normal. So that is 2 out of 5. And then I'm going to be doing the affected side now. Do you want to contract? Perfect. Relax. Perfect. That's normal. 2 out of 5. So I'm going to be doing the Achilles. That's S1. Just want to relax. I'm going to find the Achilles tendon. Okay, and that's normal, 2 out of 5. Okay, that's 2 out of 5. I'm going to be doing myotome testing. So that is testing the nerve root nervating to see if it can sustain a contraction for 10 seconds. S1, which is extension, so I'm going to get you to do a toe walk. You're just going to go on your tippy toes for 10 seconds.
Okay.
Perfect, that was 10 seconds. That's 5 out of 5. Nothing abnormal feeling?
No.
Doing S2 for knee flexions. You're going to want to bring your leg up just like that, and I'm going to be rating you out of 5, and it's going to be a 10-second contraction whenever you're ready. 1, 2, 8, 9, 10. That's 5 out of 5. Now your affected side whenever you're ready. 1, 2, 8, 9, 10. That's 5 out of 5 also, so that's normal. Strength and leg testing. So it's going to be testing you going through the range but with resistance. And then for length testing, I'm going to passively be bringing you back down. Should take about 5 seconds to go up to the full range. And I'm going to be ranking it out of 5. With Piriformis, this is you going through it. Whenever you're ready, this is your affected leg.
Okay.
So whenever you're ready. Okay, and is there pain with that?
Yeah.
Okay, so I'm going to just bring you back down for your length. And how's that?
That's better.
Okay, I would probably say that's about a 2 out of 5.
Okay.
And you did have pain with that, so that's abnormal. How's that feel?
That feels fine.
Perfect. And how's that feel?
Good.
Okay, and that's 5 out of 5, normal.
Perf.
Strength and leg testing for your glutes. This is your affected leg. We're just going to see how this feels. You're going to want to just extend your leg just like that. And I'm going to be holding your hip just so it doesn't swing up.
Okay.
So whenever you're ready. Okay, how's that feel?
That feels fine.
Perfect, and it felt fine coming back down?
Yep.
Okay, that's 5 out of 5. For your non-affected leg, whenever you're ready. How's that feel?
That feels fine.
For length, how does that feel?
That feels good.
5 out of 5. Okay, so we're going to be doing some orthopedic testing. So this is just to see if we can rule out anything or see what's causing your pain. We just can't diagnose. With Patrick's Paper 4 test. So this is where you go into the figure 4 position. So I'm going to be doing this. This is with your affected leg. How's that feel?
That feels good.
Okay. And then I'm just going to passively go like this. And how's that feel?
That feels good.
Okay. So that means you're negative. And how's this feel?
That feels good.
Okay. No pain or discomfort?
Nope.
Okay. So you're negative on both sides. If you were positive, and you had any pain or inability to do the movement, that could mean you have a hip joint pathology, or you may just have tight adductors where you can't do the movement. So next we're going to be doing the Piriformis test. So I'm going to be bringing your knee up like this, and then externally rotating, and then I'm just going to be bringing this to your opposite shoulder. How's that feel?
That feels fine.
Any pain or discomfort?
Nope.
Okay, so you're negative. Next for the affected leg, we're just going to be going up like this, externally rotating and bringing it in.
That's pretty painful there.
Okay, where's that painful?
Right in here.
Okay. You're positive. So positive for radicular leg or buttock pain could mean that you have Piriformis syndrome. So we're going to be doing the pace abduction test. So I'm just going to be resisting you, trying to abduct your legs, and we're going to see if you have any pain or discomfort. Okay?
Okay.
So whenever you're ready. 1, 2.
It hurts on my right side.
Okay. Your left felt okay?
Yeah.
Okay. And where did that hurt?
It hurt like right in here.
Okay. So that means that you're positive on your right side, you're negative on your left. Because you are positive, that means that you have pain, and that could mean that you have Piriformis syndrome.
Okay.
So we're going to be doing Gainsland's test. So I'm going to be bringing your knee up just like this, and then we're going to be dropping the other one off of the table, and then I'm just going to apply an overpressure. Okay? How's that feel?
That feels fine.
No pain or discomfort?
Nope.
Okay. So that side's negative. And the same thing. Bring this side up. Drop this leg off the table. Applying an overpressure. How does that feel?
That feels fine.
No pain or discomfort?
No.
Okay. So you're negative. If you're positive, then you would have SI pain, and that could mean you have an SI joint pathology, Or you could have your leg would lift up the table, and that could mean you have an iliopsoas contracture. Hi, Abby. So based on today's findings and the testing, you did test positive for a lot of things that could indicate that you have Piriformis Syndrome, and that could also explain why you have the numbing and tingling down the back of your leg, because Piriformis Syndrome often replicates sciatic nerve pain.
Okay.
So I would go to your doctors to see about that because we can't diagnose.
Good to know. Thank you.